Hello everyone, I'm Dr. Srijitra from Exambla Healthcare. Today I thought I'll talk about one of the common deficiencies that is seen in Bangaloreans today, vitamin D deficiency. So what is vitamin D deficiency? So as you know, vitamin D comes in two forms, that is D2 and D3, which is ergocalciferol and cholecalciferol. So we call it a sunshine vitamin because sunshine is very much important for the production of the vitamin D in your body. The sunlight will hit your skin and it will stimulate the production of the vitamin D in your body. So that's how the vitamin D is formed in your body other than from the dietary supplements. So why is vitamin D important in your body? So vitamin D, as you know, it is very much important for the absorption of the calcium and phosphorus from your gut. So whatever the food that you're taking in, whatever the supplements that you're taking in, the calcium and the phosphorus supplements that you're taking in, vitamin D is very much important for the absorption of this calcium and phosphorus from your gut or from your intestinal tract. So what happens is the body will have a low calcium level in your body, or we call it the hypocalcemia. So this hypocalcemia will trigger another response in your body and it triggers the parathyroid hormones. So parathyroid hormone is the one which is responsible for maintaining your calcium and phosphorus level in your body. So what happens is the parathyroid hormones will get stimulated and it will give rise to hyperparathyroidism. So this will result in maintaining the calcium level and phosphorus level in your body. So from where the calcium and phosphorus will come, if it is not been absorbed from the intestinal tract, if it is not being absorbed from your dietary things, from where the calcium and phosphorus will come? Definitely from the bones. So demineralization of the bone will happen. So the bones will get weakens and softens, and it will give rise to, in the long run, if you are not supplementing your vitamin D levels in your body, in the long run the bone will become weakens and it will give rise to osteomalacia or soft bones. For them, the deformity is very common in osteomalacia. The pathological fracture or even simple fractures are quite common in people who are having a soft bone. So because of this demineralization, the calcium and phosphorus will come from the bones and it will be entering into the bloodstreams. Some of the calciums and phosphorus will definitely get utilized by different organs, especially the skeletal muscles. And the rest of the calcium, because of the gravitational force, what happens is it will come and settle down in your leg, especially in the heels. So in the long run, what happens is slowly it will give rise to the calcium deposits in your heel, and we call it calcaneal spur. And many of you people might have experienced this heel pain while you're walking. And if you do the x-rays, you will be seeing that calcium deposits. We call it calcaneal spur. Because of this calcaneal spur, it will be very painful for you to walk. So these are the complications that you can expect if you have a vitamin D deficiency. So why is this vitamin D so important in your body? Of course, it helps to maintain the bone health as well as the muscle health. So proper vitamin D, if it is not there, it will result in the reduced calcium level or calcium absorption level in your body. It can give rise to muscle fatigue, muscle pains, muscle cramps, bone pains, softening of the bones, osteomalicias and things like that. And also it has a major role to play in maintaining the nervous system as well as the immune system of your body. So along with the vitamin D deficiency, you'll be able to see many more systemic diseases like that of depression, like mood swings, insomnia or not able to sleep properly, low appetite, extreme fatigue or laziness and tiredness, hair fall, dry skin or dull skin. All those things are also associated with the vitamin D deficiency. So now let us look into who are more prone for vitamin D deficiency. Of course, people who are aged, who are above 60, who are not able to move out of their home. Having people who are living a very sedentary lifestyles, people who are obese because fat absorb the vitamin D. So people who are obese tends to get this vitamin D deficiency. And people who are on medications, especially that of laxatives, some steroids, epilepsy drugs, tuberculosis drugs. People who are on weight loss medications, because some of the weight loss medications will prevent the absorption of nutrients. So weight loss medications, seizure medications. So some of these medications have a property to reduce the vitamin D levels in your body. And people who are having some medical conditions, like especially that of the GIT tract disease, like that of the Crohn's disease, like that of celiac disease, people who have done the gastric bypass surgeries, and some kidney diseases, liver diseases. So these are the few medical conditions in which there is a lowered vitamin D deficiency. Vitamin D deficiency has to be treated by supplements. So there are two ways in which we can do it, and one is a natural way and the second is a supplementary way. The natural way, definitely getting exposed to the sunlight more is one of the most common advice that all doctors gives. So you maximize your exposure to the sunlight as much as possible. And second thing is that the nutrient supplements. If you look into the food supplements, you can see that fat fishes like that of the mackerels, tuna, salmons are very rich in vitamin D. Dry fruits like that of the almond, egg yolk, cod liver oil, beef, especially the beef liver. All those dry fruits and fatty rich foods are very good with the supplements of vitamin D. But most importantly, it comes from the sunlight. So make sure that you get enough exposure to the sunlight to correct your vitamin D deficiency. And if you look into the artificial way or supplementary ways, we can see that most of the food products that we get are fortified with vitamin D. Dairy products that we get, like that of the milk or cheese or butter, are fortified with vitamin D. Some breakfast cereals I have seen that is fortified with vitamin D. So there are enough food supplements which is fortified with vitamin D, which gives you the daily recommended dose. So how do you know that you have vitamin D deficiency? So definitely by simple blood test, if you do it, you will be able to figure out if you have deficiency or not. So if the value is not around 30, then definitely that means you are deficient of vitamin D, and according to your deficiency, we will give you the dosage of it. So if the vitamin D is very low, we will be recommending 60,000 units of supplements to be taken weekly once to correct your vitamin D deficiency. And also you have to make sure you don't be proactive and start taking vitamin D in assuming that you have vitamin D deficiency. That is also very important. If the vitamin D levels are very high in your body, it will give rise to too much of absorption of calcium and phosphorus, because it gives you a whole different set of symptoms, especially in the nervous system. There will be confusion, there will be ataxia, there will be walking problems, speech problem will be there. And make sure that you don't take proactively the vitamin D. That is also very important. So once in a year at least, it is important that you check your vitamin D levels and correct it if it is very low, because it's very important for your musculoskeletal system, your nervous system, as well as your immune system. So this is regarding the vitamin D, and if you have any doubts and queries, you please make sure to comment us or reach out to us so that we'll be clearing your doubts. So that's it for today, and if you really enjoyed this section, you please make sure to like, comment and share, and also please don't forget to subscribe to our channel. So I'll be getting back with new videos on health, both physical as well as mental. Thank you so much for listening.